To treat with sprains, this is how we are going to do. The ankle is the most common sprain joint of the body. Let's look at how to render basic first aid to it. Treatment of sprains is very simple. All we need to remember is a simple bowl of rice. Why rice? It stands for rest, ice, compression, and elevate. Rest the joint if you are at the middle of a work. Stop putting pressure on affected area. If you choose to ignore the sprain, you will risk permanent damage. Ice the affected area. To do this as soon as possible to limit the swelling after an injury. Always remember, do not apply ice directly on skin and try to wrap it with a towel. Compress the affected area. A crepe of bandage from your first aid kit will work well for this. Elevate the joint. If possible, try to raise affected area above your heart. This helps to prevent and limit swelling. This process can be done 4 to 8 times a day up to 2 days after the injury. Do not also note that you should only ice the sprained area for up to 20 minutes at a time to get a medical assistance. If the patient experiences any of the following, develop redness or redness streaks that is spread out to the injured area, or if the area has been injured for several times. When it comes to treat with a fractured person, this is how we do it. A break or crack in the bone is called a fracture. A bone or a broken bone does not fracture. The skin is called closed fracture. But sometimes, the bone can puncture the skin is called an open fracture. Even if you can't see any blood, the break will have caused some internal bleeding, and the injured person may develop shock. Bones that are still growing, like children's bone, are simple, unsupple, and can split, crack, or bend quite easily. A bit like twig, but the injury is still very painful. If you will think someone has a fracture, you may see swelling and bruising, difficulty moving, and have movement in an unnatural direction. Their limb may look shorter, twisted, or bent. There may be a grating noise or feeling if the limb is moved, have loss of strength, or see signs of shock. If you think you've broken a bone, support the injured part to stop it from moving. Place padding around the injury for extra support. If it's an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply pressure around the wound, not over the protruding bone, to control any bleeding. What we will is to call a help to emergency or to the LGU near you. While we are waiting for help to arrive, don't move the casualty unless they are an immediate danger. Or we should talk to the injured person to remain calm. Support the injured area. For example, fracture from the arm can be secured against the body with sling. Fracture to the leg can be secured to injured leg with a triangular bandage. Keep checking the person, but do not raise the injured leg. If necessary, raise the injured leg. If they become worse responsive at any point, prepare to treat an unresponsive casualty. So remember, pad and support the injured area. Use a sling or a triangular bandage to keep it secure. Cover any wounds and call emergency near you. And that's how we treat someone with a fracture.